All right, having high quality heart health care nearby, it's pretty invaluable for you, especially when you're getting older. Young people need it nowadays more than anything. Today, we're learning more about some of the latest breakthroughs in heart health research at Lee Health. Joining us here in the studio this morning is Doctor of Research for Lee Health's Heart Institute, Dr. Michael Lipinski. Thank you so much for being with us here this morning.
Thank you so much, Josh.
And this is such an important topic that we're talking about because, a lot of us look at, just ways that we already get treated and you think, oh, I can just go to the doctor and everything. They know what to do exactly. But we're constantly looking forward about other ways that we can keep our heart healthy. Yeah. What are some of these special research projects that y'all are working on right now, especially within Lee Health?
Yeah, so much of the focus in the past has been on a condition called aortic stenosis, which is a severe narrowing of the aortic valve, which is the valve that separates the bottom chamber of the heart and through which the blood is pumped to the rest of the body. And so in the past, patients with severe aortic stenosis would require open heart surgery to treat that. But now we're able to actually travel through a catheter through the leg from the artery in the leg up to the heart and replace their heart valve using that technology. We're also hoping to expand into treatment of mitral and tricuspid regurgitation, which is severe leaking of the mitral and tricuspid valve, which can oftentimes lead blood to travel back up into the lungs and cause people to become short of breath and have heart failure.
Wow.
And so there's new technologies we're working to develop for that. And then finally, an area that we're hoping to expand into is bioresorbable stents and drug-coated balloons, where we can treat severe narrowings or blockages in the arteries of the heart and then deploy a stent that dissolves over time and does not require the patient to be on blood thinners for so long.
Wow, that is so cool, especially when you're trying to think about long-term care. How do people especially start thinking about how they're finding the right care, especially when there are a lot of these research projects out there that y'all are looking into different ways of treating the heart?
Yeah, so I think it's really important to kind of have a great relationship with our patients. One of the things that we can offer is, if we can bring these new technologies and therapies to our patients locally, we can give academic-like care for our patients here and be able to give them access to these newer technologies that develop.
Yeah.
And so one of the things that's allowed patients, which has been great, is the ability to do TAVR, transcatheter aortic valve replacement. Now we can give patients these heart valves without having to do open heart surgery, and that helps improve quality of life and helps the patient get through the surgery much easier.
Is that kind of what's most hopeful driving this, that a lot of people are looking at, is that it's not so invasive anymore?
Yeah.
Or is it also, these simpler, or I would hope that there are a lot simpler techniques like using the stents that can dissolve?
Yeah, so the ability to treat arteries and to treat valvular disease with less invasive options is always ideal and still provide the same outcomes for our patients. One of the technologies with drug-coated balloons and bioresorbable scaffolds or stents is the ability to treat an artery and then leave nothing behind. So we can open up a blockage or a narrowing, and then instead of leaving a permanent stent that will be there forever, it can dissolve over time and thus minimize the amount of duration someone needs to be on blood thinners.
Well, Lee Health is one of the, it's one of the biggest healthcare systems here in this area. And why is it so important that we're getting to do some of these trials here for our patients?
Yeah, I think providing optimal care for our patients is most important, and we can have this access to technology and give people an opportunity for treatment that may have not been available for them before. And so I think that's really important. And then also avoiding having to travel, especially as many of these patients are with heart disease are oftentimes elderly, and travel becomes quite problematic. And I think that helps facilitate excellent care for our patients.
Well, thank you so much, Dr. Lipinski, for explaining some of this to us. It's so cool to hear how we are advancing here on the Gulf Coast, our heart health especially. We're going to have more information up on the Gulf Coast News app for you as well, especially if you want to maybe talk to your own doctor about some of these treatments as well and these trials. Yeah. Thank you again for being with us this morning.
Thanks.
All right, let's check in with Jason here this morning. What's coming up next in our next half hour?